Canine parvovirus is one of the deadliest infections in puppies. Within days, a healthy dog can become critically ill. But if you understand it early, you can save lives. Canine parvovirus, also called canine parvoviral enteritis, is a highly contagious viral disease that mainly affects young, unvaccinated dogs. It is caused by canine parvovirus, a very resistant DNA virus that targets rapidly dividing cells in the body, especially those in the intestinal lining, bone marrow, and lymphoid tissues. Due to this, the virus causes severe intestinal damage leading to diarrhea and poor absorption, along with suppression of the immune system due to decreased white blood cells. In very young puppies, it can rarely affect the heart, causing myocarditis. Next, let's discuss how the disease spreads and its epidemiology. The virus is transmitted through the fecal-oral route, either by direct contact with infected dogs or through contaminated objects. It is highly resistant and can survive for long periods outside the body. Puppies between 6 weeks and 6 months of age, especially those that are unvaccinated or incompletely vaccinated, are at highest risk. Moving on to clinical signs. After an incubation period of about 5 to 7 days, affected dogs initially show lethargy, loss of appetite, and fever. This is followed by vomiting and diarrhea, which is often hemorrhagic, although it may sometimes be non-hemorrhagic. On examination, animals are usually depressed, dehydrated, and may show abdominal pain. In severe cases, the condition can progress to septic shock. Diagnosis is usually suspected based on age, vaccination history, and typical clinical signs. It is confirmed using fecal antigen tests such as ELISA or more sensitive methods like PCR. Blood tests commonly show leukopenia, especially low lymphocytes and neutrophils. Finally, we turn to treatment, which is mainly supportive since there is no widely used specific antiviral therapy. Fluid therapy is the most critical component, used to correct dehydration and electrolyte imbalances. Mild cases may receive subcutaneous fluids, while severe cases require intravenous fluids. Electrolyte and glucose supplementation may also be needed. Antiemetics such as maropitant or ondansetron are used to control vomiting. Broad-spectrum antibiotics are given to prevent or treat secondary bacterial infections due to intestinal damage. In some cases, newer treatments like monoclonal antibodies may also be used. Prevention of canine parvovirus relies primarily on a complete and timely vaccination schedule. Beginning with the first dose administered to puppies at 6 to 8 weeks of age. Then boosters are given. First dose at 9 to 11 weeks, second dose at 12 to 14 weeks and last third dose at 16 to 17 weeks of age. After the initial series, a fourth booster is typically given at around 6 to 12 months of age, and then revaccination is recommended every 1 to 3 years depending on veterinary guidelines and risk factors. Strict hygiene and proper disinfection are also important, as the virus is highly resistant in the environment. Isolation of infected animals and good sanitation practices in kennels and shelters are critical to prevent outbreaks. Parvovirus may be aggressive and fast-acting, but with timely intervention and proper prevention, it is a disease that can be controlled, and most importantly, prevented. If you found this helpful, don't forget to like, share, and subscribe for more simple and clear veterinary lessons.